Hello, my name is Megan Breckling, and I am an academic detailing and ambulatory care pharmacist at UIMS. And today I would like to talk to you about an ongoing research project called Academic Detailing for Opioid Prescribing, using educational outreach to reduce opioid prescribing rates. This project was developed and funded by UIMS in partnership with the Arkansas Department of Health and Arkansas State Drug Director's Office. I would like to note that all authors involved with this project do not have any financial conflicts of interest. I would first like to begin with some background information on the project. It is well known that opioids are a leading cause of overdose in the United States. To address the opioid crisis, the Center for Disease Control and Prevention issued a set of 12 guidelines in 2016 to improve the way opioids are prescribed. However, Arkansas still remains the second highest opioid prescribing state, with a prescribing rate of 80.9 per 100 persons in 2019. That rate was nearly double the US average of 46.7 per persons. Half of all opioid prescriptions written are normally in a primary care setting, so this puts primary care providers on the front lines of the opioid epidemic. The intent of this academic detailing program is to disseminate information pertaining to the CDC guidelines, utilizing one-on-one evidence-based education sessions with primary care providers. The goal of the program is to increase opioid safety in the state of Arkansas by decreasing high-risk opioid prescribing and increasing the use of evidence-based non-opioid pain management strategies. At the start of the project, primary care providers were selected from 17 counties with the highest rate of opioid prescriptions per capita. And this was based on data provided by the Arkansas Prescription Drug Monitoring Program, as shown in Figure 1. A total of 258 providers were mailed a letter to introduce the academic detailing program. And 1 week after the letter was mailed, clinics were contacted by phone until a visit was scheduled or the clinic refused the visit. There also was some drop-in visits that were attempted at clinics that were not responsive. Materials were developed for use during the visits and included both a provider guide and a patient handout. And these educational sessions and material focused on the following: establishing realistic goals for pain and function, maximizing multidisciplinary therapies and non-opioids for pain management, continually assessing the benefits and risk of opioid therapy, limiting acute opioid prescriptions to 3 to 5 days supply, limiting chronic opioid treatments to less than 50 morphine milliequivalents per day, eliminating concurrent use of opioids and benzodiazepines, and then assessing for comorbid mental health and substance use disorders. A total of 103 providers representing 16 counties received the academic detailing visits by a trained pharmacist during June of 2019 to November 2019. And these counties had an average opioid prescribing rate of around 150 per 100 persons in 2017, as shown in Table 1. 80 sessions details were also collected in a REDCap database, and this include visit duration, topics discussed, materials provided, the provider receptiveness and their concerns, and then any requests they had for additional information. The majority of these providers that were educated were MDs, and they were in a rural primary clinic setting. The average length of the detailing visit was 19.5 minutes, and this is all shown in Table 2. Primary care providers were also asked to complete a post-visit survey that evaluated the success of the educational outreach. Overall, the majority of the primary care providers surveyed felt that the AD's academic detailing session disseminated useful information, and these results are shown in Table 3. Of the 30 survey responders, 22 of them, or 73%, felt that they implemented changes to their pain management approach. As a result, the most common prescribing practice that they reported to change was that they were more likely to maximize opioid treatments for pain management. Non-opioid treatments for pain management. Providers also scored the sessions on a Likert scale, and it was 1 being the least useful and 10 being the most useful, and the average score was 8.4. So in conclusion, primary care providers who received academic detailing visits indicated it was an effective approach to change opioid prescribing behavior. Provider feedback suggests that their rural communities faced unique challenges that may limit a multidisciplinary approach to pain management. Some of the barriers that they said included a lack of access to such treatment disciplines and modalities, adequate transportation, and then some financial limitations for patients. There is a need for future research to explore strategies to reduce opioid use and effectively treat pain in these rural communities. However, in 2020, the COVID-19 pandemic halted in-person visits for the AD team, and we had to modify our methods of correspondence. This AD research project will continue through November of 22 with the goal of resuming in-person visits when possible. Thank you.